campaign, we are so very excited and honored to continue working closely together to improve the lives and health of California's children. We also wanted to take the opportunity to first thank Dr. Mary Beth Phillips for her great support and leadership in making this webinar a possibility. We've worked closely with the California Child Care Resource and Referral Network to create this presentation and are hopeful you will find it useful as a tool and resource now that the Affordable Care Act is in place. Today, my partner Danielle and I will cover the Affordable Care Act and how it relates to the state, the All-In campaign, and then wrap up with a brief Q&A as Karen kindly mentioned. And to get things started, Danielle Rooks is the Program and Fiscal Coordinator of the California Coverage and Health Initiatives. CHI's mission is to improve the health and well-being of California children and families by supporting its members and meeting the needs of children. Danielle is the CCHI liaison for the All-In campaign and provides grant and accounting support to the agency. She'll go ahead and kick us off. Danielle, are you there?
Yes, and good morning, everyone. I'm going to first begin to talk about what the Affordable Care Act is, also ACA or Obamacare. I think most consumers are comfortable with the Obamacare terminology. But as you may already know, on March 23, 2010, President Barack Obama signed the Patient Protection and Affordable Care Act into law. The Affordable Care Acts are designed to put consumers back in charge of their health care. Under the law, a new Patient Bill of Rights gives individuals and families the stability and flexibility they need to make informed choices about their health. There are new insurance reforms that have and will continue to roll out starting in 2010. And some of those highlights include new consumer protections, increased access to affordable care, and, for example, extending coverage to young adults. Under certain conditions, young adults are allowed to stay on their parents' plan until they turn 26, improving quality and lowering costs, offering prescription drug discounts for seniors, and also understanding and fighting health disparities. This is a defining moment for all of us and for all those who are helping to enroll children and their families. On the next slide, it's talking about the Affordable Care Act and what it offers. The Affordable Care Act offers guaranteed coverage, no denial for pre-existing conditions. Rates are not based upon your health status. There are comprehensive benefits and also an affordable choice of plans. And I just wanted to emphasize, as it relates to the no denial of pre-existing conditions, that the Affordable Care Act implements and really strongly enforces prohibiting health insurance companies from refusing to sell coverage or new policies because of an individual's pre-existing condition beginning in 2014. And in addition, under the Affordable Care Act, a plan cannot deny or limit benefits or deny coverage to a child that is younger than 19 because the child has a pre-existing condition or a problem that occurred as the child is applying to a health plan. So those are really key, important coverage for families and individuals. Okay, next slide, thank you. The Affordable Care Act provides essential benefits for families and individuals. These are also duplicative of the benefits for Medi-Cal, and they include emergency services, maternity, newborn care, mental health, substance abuse, laboratory services. And so these are all essential benefits for both under Covered California, which I'll talk about a little bit later, and for Medi-Cal. Next slide. So gave you a little bit of an overview of the ACA. Now going to talk briefly about what Cover California is. And wanted to give you just their mission. The mission of Cover California is to increase the number of insured Californians, improve healthcare quality, lower costs, and reduce health disparities through innovative, competitive marketplace that empowers consumers, us, to choose the health plan and providers that give us the best value. So Covered California is the new marketplace that was created under the Affordable Care Act, under Obamacare, and it is the first healthcare exchange in the country. And California is only one of 17 state-based marketplaces. And it's the only place to go and buy health insurance and receive financial assistance. In the Cover California marketplace, it offers the individuals to provide health insurance, but also for folks who require it, it provides federally funded tax subsidies for millions of Californians with incomes up to 400% of the federal poverty level. Who can benefit from Covered California? Well, we have 5.3 million California residents. 2.6 million may be able to get financial assistance through the tax and cost sharing subsidies. And also you have legal residents that may be currently without coverage, able to receive Cover California benefits as well as Medi-Cal. Families would receive Covered California subsidized coverage if they were not eligible for Medi-Cal, and also if their incomes fell between 100 and 400% of the federal poverty level. And the assistance will vary depending on the income. So it's a wonderful opportunity for everyone to be covered, and that is the purpose of the law and the purpose of Covered California. Next slide, please. So again, Covered California is affordable. There are no annual limits. Your premiums are based upon your income. There's free preventative care, which I think is a very key benefit, and also lower out-of-pocket maximums. Next slide, please. Covered California has many program elements that are focused on ensuring its premiums are affordable as possible. Currently, there are 12 health plans that operate under Covered California, and they offer 4 different levels of benefits. And I'm just giving you a basic overview. There are 4 different plan levels that are designed to offer a range of affordable options. And on the slide above, you're going to see different tiers. The lowest plan, which is bronze, which is the one at the top, requires that the health plan would pay 60% of the costs while the consumer pays 40%. While the deductible and the out-of-pocket costs are higher than the upper tier plans, it offers families who do not see the doctor very often the option to pay a lower premium. And this is also not taking into account any type of premium assistance or tax subsidies that are provided. There is also a catastrophic plan offered to the Young Invincibles, which are young adults that are under the age of 30 who rarely see a doctor. They have the option to purchase a low-cost plan for catastrophic events, but it does not cover regular doctor's visits. The open enrollment period for Covered California plans began on October 1st, and coverage begins January 1st, 2014. Next slide, please. So now I'm briefly going to go into Medi-Cal, which many of you are familiar with. Medi-Cal offers no cost and low cost health insurance to those individuals that meet the eligibility requirements. To qualify for Medi-Cal, an individual or kids and families must be California resident and have an income at or below the allowable income limits. Medi-Cal also offers a comprehensive set of benefits known as the essential health benefits, the same as Covered California, and they include the same information in the previous slide: maternity health, prescription drugs, mental health, laboratory services, and emergency services. So currently 8.5 million people are enrolled, and half of all children in California as well. Next slide, please. Next slide, please.
My apologies. I think there might be a slight delay.
Oh, okay. That's okay. Thank you so much. The next slide talks about who can benefit from Medi-Cal. And I think this is a really exciting slide because it's really talking about getting into the Medicaid expansion, which is another part of the Affordable Care Act, is the Medicaid Medi-Cal expansion. And so 2.4 million adults may become newly eligible for Medi-Cal, and this is due to the expansion. I also want to take a moment to point out that not all states are participating in the Medicaid expansion. Currently, only 26 states are currently expanded their Medicaid to ensure that everyone has the opportunity to have health care coverage. So it's really wonderful that California has expanded Medi-Cal. And the way that it's being expanded is a few items I wanted to point out. They're establishing a new standard for determining income eligibility, and it's based upon the modified adjusted gross income, which is called MAGI. And it's consistent with the standard used to determine eligibility for the premium tax credits. It's also eliminating the asset test for individuals and families whose eligibility determination is based upon the MAGI, which is huge. And if you could be off mute, you'd probably be cheering. In addition, the expansion is covering childless adults up to 138% of the federal poverty level, about $15,856. It's also covering and expanding to former foster youth who are in foster care in any state up to the age of 26. And in addition, it's providing coverage for recent legal immigrants for the first 5 years. They're here the first 5 years. And they are provided coverage through Covered California with the Department of Health Care Services to provide assistance with their premium and cost sharing, which is referred to as the Medi-Cal wrap. And just to also provide an overview, it takes about 45 days for the Medi-Cal applications to be processed and 90 days for applications based upon an individual family with a disability. So to just, again, give you an overview, who can benefit, it's everyone that can benefit, that are, that's a childless adult, that their incomes are below 138%, folks that are also U.S. citizens, legal permanent residents. So it's expanding to everyone to ensure everyone is covered. And it provides examples in the slide above. Next slide, please. Your eligibility is based upon, as you're talking to families, it's based upon their household income. and that means the individual plus any family members that they claim as dependents on their taxes. And on the chart above, it just provides you the income levels and what programs in terms of assistance that you would be eligible for. So either Medi-Cal, or if you're above those rates, the premium assistance that you could possibly be provided under Cover California. So if you're eligible for Medi-Cal, you would be provided no cost or low cost coverage. And if you're eligible for the Cover California, meaning you're over the income, you would have possibility for help paying for your monthly premiums with the premium assistance. And the amount of the assistance you qualify for would be based upon the household size and your income and the family's income. Next slide, please. Helping consumers enroll, which is a lot of what you are involved in and your providers may be involved in, and as we're talking about healthcare coverage. But just a few points of information to gather that you would need and families would need W-2 forms, and also to make sure that the individual and their family have their Social Security numbers. So that's just some basic information there. Next slide, please. So this slide discusses the open enrollment dates. Obviously, open enrollment for Cover California began October 1st, and it goes through March 31st, 2014. For Medi-Cal, you can apply at any time. There is no open enrollment period. And for adults, it started on October 1, at least for the expansion. And I also wanted to point out here that there are special enrollment periods for families and individuals if a life-changing event occurs. This is after the open enrollment ends. For example, they would have to apply within 60 days of occurrence, and that would include a birth of a child for the child, moving to a new state, marriage or divorce, loss of minimum essential coverage, moving to a new plan area, and also release from incarceration. So those special conditions would allow an individual or family to enroll for healthcare coverage outside of the open enrollment period, but it would just have to be within the 60 days of that occurrence. Next slide, please. And just to wrap up in terms of how to enroll in Covered California, there is no wrong door for individuals and families to enroll. They can enroll online, on the phone, in person with a certified enrollment counselor, and by mail. And the information is there on the screen, going to www.coveredca.com and the phone number. And again, the open enrollment periods have started and go through March 31st, 2014. If there are any questions, please feel free to go ahead and email those questions to us, and we'll be happy to answer that for you. And I'm now going to be happy to pass you off to Melissa, who's going to talk to you more specifically about the All-In campaign. Thank you very much for listening.
Thanks, Danielle. That was was really
Thanks,
great, super
Danielle. That was
informative.
really great, super informative.
So as Danielle mentioned, also if you guys have any questions, feel free to type them into the little chat box on the right-hand side. And if we aren't able to answer them at the end, we'll absolutely make sure to email you responses so that we're all in the know. And before we get started into what the All In campaign is, I really just wanted to take a moment to really applaud you guys. For over 30 years, as you are all very well aware of, the R&R Network has not only been a leader in California, but the nation in creating and developing a comprehensive childcare system. By having an R&R service in nearly, well, in every county in California, childcare providers and R&R networks literally touch the lives of millions of families in this state. Each one of you has the power to connect children and families to health coverage. And I know you're all very well aware of this, but I really want to highlight that because it's so powerful, the reach that the R&R network and childcare providers have. And the All In campaign really wants to help make the process of informing folks about the Affordable Care Act, about Covered California, and about Medi-Cal just much easier for you, not only for you, but also for the children and families that mean so much to you. So because of that, we really wanted to take the opportunity to have a webinar and go over a brief presentation just to see how it is that we could possibly work together. So what is the All In campaign? All In is a statewide campaign to inform millions of people in the school community who are uninsured about health coverage options that are now available through the Affordable Care Act and help them enroll. We're going through the school and education path, so we're trying to reach out to as many um, schools, after school programs, childcare providers, the R&R network, because we want to make sure that children, parents, school, and childcare employees and after school staff know about the Affordable Care Act and know how it is that they can go about accessing affordable health care. We have, luckily, we have a really great anchor partners that are supporting us and helping us put together presentations and materials. As you all listen to Danielle, she's from the CHI, and of course, we also work closely with the Department of Education. Superintendent Tom Torlikson is greatly supporting us, and we're so appreciative of his help. He continuously is sending out letters to his members, advising them and reminding them about the All In campaign and that folks can really start now enrolling in affordable healthcare. And we also have a great partnership with the California School Boards Association and the California School Health Centers Association, and of course, Covered California. And we're also very proud to be partnered up with the California Endowment's Get Covered and their Asegúrate campaign, which some of you may be aware of that they're running a huge Spanish media campaign in the state and reaching out and working closely with the three main Spanish media, which is Telemundo, Univision, and La Opinión. And last week, they actually covered some stories on us. So it was really a wonderful opportunity to get the word out to the Latino and Hispanic communities of California. Now, why should childcare and R&R networks care about the All In campaign? And I think the most important thing is really because we all know that healthy kids make good learners. That's the main gist of things. We want to continue to give children an opportunity to get ahead in life and really pursue their careers and their dreams that they may have. And if they don't have healthcare, then they're going to end up losing a lot of opportunities to prevent sicknesses and to be on the healthy track. And we really want to be able to reach out to childcare and R&R networks because families trust the information that they receive from you. You're both uniquely positioned to serve as on-ramps to connect uninsured children, parents, and staff to coverage. And we have the opportunity to impact the lives of nearly every single uninsured child and parent if child care, early childhood education, Head Start providers, schools, and other family-focused programs get all in. And this next slide is the potential is great, and it really touches on the possibilities that there are. And currently there's over 11,000 child care centers across California, and this includes Head Start sites, and nearly 33,000 child care providers in the state with over 10,000 schools. And nearly 4,500 after school programs in California. If we can get each one of those entities, which is, gosh, I'm not too quick on my math, but if it's, believe it's nearly 60,000 entities, if we can get each one of those to get all in, then we can really distribute and disseminate necessary information that is easy to read and easy with easy to do steps. Now, the way that the All In campaign can help is that we have some campaign elements available for folks. Obviously, we have our website, which has been at the bottom of each of the slides. And as Karen and Danielle mentioned, it's www.allinforhealth.org. We have materials in both English and Spanish, and we also have social media outreach via Facebook and Twitter. And we really want to work together with the community to put together enrollment events. So those are some of the ways that we can all get involved. The toolkit, if you end up going, or when you end up going to our website, consists of fact sheets and game plans that we've put together for folks. And so far, we have a fact sheet for school leaders in English and Spanish, fact sheet for parents and families, also in both languages. And we're in the process of finalizing a fact sheet for child care providers and after school providers. And these will absolutely be drafts that we send over. And Mary Beth, I would love to get your input on them and see how it is that we can really make these stronger to make sure that they're as helpful as possible to the community. And we also have a game plan for school leaders with, really lays things out, what you can do to get involved and what you can do to be all in. And one of our favorite ones is the wallet card, which I think you'll see in the next slide. Oh, no, not yet. But the wallet card is really great because it's easy. It's easy to read. It's the main gist on Covered California, 3 ways to access more information or to enroll. As Danielle mentioned, it has information on the website. You can call and receive information. You can find a local location to go and speak to someone in person. So it's really great to be able to have this wallet card handy. And then once you're in the community talking, with your family or your friends or a stranger that you end up running into in the grocery store and mentioning Covered California, you can whip up the wallet card, provide them with it, and let them know that they can access basic information here and enroll for affordable healthcare. So I think the wallet card is really great. I hope you guys agree. Now, how can you help? A few ways that you can help is obviously by sharing information about healthcare options with all families. You can do this by going to our website and downloading the All In Campaign Toolkit and distributing to folks. Provide health coverage information at events taking place. That can include parent meetings, health fairs, and other types of family activities. It would be absolutely wonderful if everybody can place information on their program website, even, basic information like check out the All In campaign to find informational materials on the Affordable Care Act and Covered California. If you can, write a blog or just mention us in the blog, I think that would be really wonderful. And obviously, retweeting and liking our social media posts would also be very beneficial. We all know the power of social media, and the reach just keeps on going and going. And I think this is really about what it is that you can do and how that impact ends up being exponential. And we all know, the butterfly effect. And when you're able to really have a great conversation and provide at least, one parent with basic information, that parent is going to feel so much more empowered. And you know what they're going to do on that next Sunday? They're going to sit down with their family and they're going to mention all the information that you told them. And then they're going to share the materials that you gave them. And with word of mouth, we'll really be able to help a lot of families out there. One of the most impactful ways that you can help is by hosting an education and enrollment event. I have to share, we had a virtual rally last week with some folks, with over 200 folks actually that had participated. And one of the things that we highlighted was field stories that were taking place of how folks were getting involved with the All In campaign. And One in particular is of a young woman. She's a 17-year-old high school student in Carmichael, California, which is in the San Juan Unified School District. And she's decided for her senior project to launch a junior all in campaign. And this young woman has already recruited 15 of her fellow students, and they plan on reaching out to 22 other schools in the San Juan Unified School District and providing them with all in materials. And this is just like the beginning of her phase. So it's a whole educational phase where folks can learn about ACA and what they can do next. And after winter break, she plans on putting together a back to school enrollment night at her high school where folks can come in and again receive information, receive a basic overview, but also we're going to work closely together to make sure that we can get a CEE there, a certified enrollment entity, or a certified enrollment counselor so that they could provide on-site assistance to families and students that attend the enrollment fair. So those are just, that's just one example of what it is that we can do together to get the word out. And again, this is our contact information. Please feel free to visit the website allinforhealth.org, or you can always email us allinforhealth@childrenspartnership.org. Our direct telephone number, which goes to me, I would love to talk to you guys, is 916-844-2413. If you have any specific questions for Danielle, who did such a great job with the presentation, thanks again, Danielle, you can email her at drooks@cchi, the number 4, families.org. And of course, my personal email is mvargas@childrenspartnership.org. I hope that I was able to provide you all with a brief overview of the All In campaign. I would absolutely love to talk with you more about different possibilities that we can work together to make sure that our families and our kids are insured. If you have any questions, please go ahead and type them into the chat box, or the question section of the panel bar on your right. And Karen will go ahead and help us go through those questions, and Danielle and I will do our best to answer them. So back to you, Karen.
Great. Thanks, everyone. Thanks, Melissa. Really good information. We actually do have a few questions. I want to remind everyone, though, that if we don't get to your question, please know that we will get back to you via email with an answer. We're, just on a limited time here. We know that everyone is busy, and we want to make sure that we don't keep you over time. Our first question is, are tax subsidies a credit on taxes or a deduction for taxes owed? If your income is reduced in 2014, are you still determined eligible based on 2013 IRS 1040?
Hi, this is Danielle, and I'm definitely wanting to get back to you on that question because that's a very technical one, and I don't want to misspeak. Some of the information that I'm receiving, which is a wonderful contact, is through the County Welfare Directors Association of California. But if I will do some research on that specifically and get back to you directly on that.
Perfect. So that was from Terry, and Terry will get back to you. Our next question: before the ACA, I would direct families with special needs to healthy families. Where can I refer them now?
Hi, Karen. Again, this is Danielle, and I'm going to take a bit of a stab at that question in terms of relations to special needs. And it does depend on the family's income. Families with income, I believe, under $40,000, regardless of the size, they would qualify for a program called California Children's Services. Others with income under the 250% of the federal poverty level would be under Medi-Cal. So that is a simple question or a simple answer there. They may also be able to qualify for Covered California plans. but may need to think about their out of network costs in that regards. It depends on the special needs of the child. So that is a shortened answer.
Okay, our next question
Okay, our next
from
question.
Belia. Is the All In campaign created only to disseminate information for covered California?
And this is Melissa. No, it's not only created to disseminate information about covered California, but we are trying to just really simplify things for folks. And we know that previously there were so many different locations and entities to send folks to. So we're really just trying to keep in mind that covered California should be the main hub where we direct folks to access more information, and from there, Covered California assisters and entities will be able to direct you, depending on your whole application and enrollment process, as to where it is that you can go if you fit under Medi-Cal or any or whatever else it may be. So we're just really trying to keep things simple for folks and direct them to the main hub so that they can be sent to their specific location for more needs.
Great, thanks, Melissa. Next question. If I am interested in partnering with All In to organize an enrollment event, how much time should we allocate for that?
Danielle, do you mind if I take that question too?
No, no problem.
Okay, thanks. Well, I think it would really depend. If you have about 10 or 20 folks that are interested in an enrollment event, then the process for enrolling with the application, it normally takes about an hour or so. So it really depends like what education level folks are at with the Affordable Care Act and with Covered California. If they have all their necessary information on hand, like their social security card, what their number is, and how much their income was, and if they have like that basic information, then the whole process will be much quicker. But if they don't, it will obviously last a little bit longer. But I would say we could designate like about an hour and a half to 2 hours and make it, a longer fare if the resources are there, meaning that we have available computers with internet access just to make things easier. And it really just kind of depends. I would love to have a more detailed conversation with you to find out when you would like to organize an event, and then we can really take it from there, figure out how many folks you think would attend. We would end up reaching out to our core partners and also other Covered California grantees to make sure that we have enough folks on hand for your event to that they'll be able to directly provide on-site assistance for the families. So that's a really great question. I know I kind of was a little long-winded about it, but essentially we can plan for an hour and a half, and it all just really depends on the details.
Perfect. Next question. What if a family does not want to get insurance? Are there penalties?
Hi, Karen. This is Danielle, and I just first wanted to make sure that as we're discussing about healthcare needs, that there's a lot of to encourage families that there are a lot of good reasons to get covered, and being able to access healthcare may be a worry for families, but it's it's just really important, and folks may be very surprised on how easy it is and how affordable it is. However, if families or an individual decides that they do not want to have coverage, there is a fee, and there are some exceptions to the fee, and that's a bit of a laundry list. And if folks are interested in some of the exemptions, you could email, and I can present that information to you offline. But for 2014, right now, if you're not covered, it's 1% of your income or $95, whichever is higher. And it does mean paying a fee. And in addition, you would still be responsible for 100% of your medical care and your medical costs. So it is important to be covered. And I don't think people should be scared or feel like this is an intimidating process. I really want folks to be very proactive about their health, just like car insurance or any other type of insurance. Um, it's important to have it and have the benefit. So that's the quick answer to that question.
Great. Okay, we have time for a few more questions. This one is from Cindy. My understanding is that you have, my understanding is that you have to have been certified as an educator to talk to people about the ACA. So as an R&R person, can they educate people without the educator classes and certificate?
I can try to take a stab at that. Uh, so in order to be considered like a certified enrollment counselor, you do have to go through covered California trainings and fill out the application and the background check and everything like that. But I think that you can just essentially, you can't call yourself that you are certified. And I think if your organization would end up supporting for you to become a certified enrollment counselor, I think that's something that would end up making your organization that much stronger and really provide the support that that families and kids could really benefit from. Danielle, do you have anything else that might help with that question?
There are, outreach and referral grants that are all across the state, and there are agencies that are designed to educate and provide outreach to families and communities. One suggestion would be to link in with some of those agencies as well and partner with those community-based organizations and kind of become part of their network in terms of making sure that you just have the right information and the correct information as well. So I think that would be really really important because there's a lot of resources out there and everybody's doing the same thing and trying to meet the same end goal.
Mm-hmm. And this is Melissa again. If you go to Covered California's website too, they have a app towards the right hand side that has a little person icon, I think, with headphones on. And if you click on that one, then it takes you to another page that allows you to search for certified enrollment counselors in the area. And all you have to do is input the zip code. And we've been, since we're partnering up with Covered California, they've been kind enough to also provide us with a list of some grantees and folks that could provide on-site assistance too. So if you wanted to look more into it, you can always go to Covered California's website, or you can go ahead and shoot us an email or a phone call too, and we'll do our best to put you in contact with somebody else closer to you that may be able to go into more detail about things or provide you with, kind of partner up for something.
Great. Okay, I think we have about one more question here. Along with the fact sheet for childcare providers that you are creating, will you also put together material for undocumented folks?
Yes, that's such a great question, and that's something that has been on our radar, along with so many on the ground folks' radar. And you know, unfortunately, we don't have a fact sheet created now, but it is something that we certainly want to put together, and we will be working with Covered California and other organizations to put together the most factual and up-to-date information about helping out mixed status families. So please stay tuned.
Alrighty. How will coverage affect or benefit families that have young and 18-year-old plus children living in the home and not married? Can the family receive services for older children separately?
I'm
Danielle, would you?
trying to, this is Danielle, I'm trying to listen to the question carefully. The short answer is families could have uh, different statuses, I guess, depending on the family and their situation. So it's possible that a child could be on Medi-Cal while the family is also purchasing a covered California plan. I think it would be best to start with Cover California because it's screening for both uh, Medi-Cal and the health plans. I think it was, I'm not sure of the question about whether the person was 18 years of age, still living at home. Um, Through the Affordable Care Act, a child can be under their parent's plan until age 26. So if that's that situation, then that 18-year-old would still be covered. Um, but again, a lot of it depends on the specifics of the family and those dynamics and the income. But it could either be a mixture of Medi-Cal or Covered California or just Covered California. I hope that if that doesn't answer the question, be more specific and we can get back to you. But
Okay, well, that was from Claudia. So, Claudia, if you have any follow up questions on that, then please feel free to send them to us. Next question. This is from Belia. If our agency is already involved with one of the grantees in our county and we have staff who are certified educators, can we be involved? Can we be involved in this all in campaign?
Yes, we would love for you to be involved. We want everybody to be all in. And I think if you were to partner up with us, it would just serve as an additional type of on ground, on site resources that we can also direct folks to. I know that, within the past couple of weeks that the campaign has really been launched, we've been getting a lot of inquiries um, for other school districts and other areas that are really looking for on-site assistance. So we're putting together a database of folks that we can reach out to aside from our core partners. So if we can count on you for that, that would just be absolutely wonderful.
Great. Those have all been really, really helpful questions from everyone. I think that's all that we have right now. If you do have any follow up questions, please feel free to contact us at allinforhealth@childrenspartnership.org, and we'll be more than happy to respond to those emails. That is about all that we have right now. Any parting words, Melissa, Danielle?
Absolutely.
Danielle, I just wanted to go, Melissa.
Thanks. Thank you all so much. Talking before with Mary Beth about getting folks to attend the webinar and participate. We were really excited about getting possibly 10 folks, but I really want to send you guys a round of applause because we had nearly half of um, the counties represented on this phone call, and I just think that just shows so much dedication from your behalf. And please know that All In and the CHIs and the Children's Partnership are absolutely here to provide any type of support and technical assistance that you may need. So please, let's just open up the lines of communication and stay in communication. And best of luck moving forward. Thank you, folks.
Thank you, everyone. I just also wanted to just add our website, which is www.cchi, the number 4, families.org. It's part of my email address. It provides information about health and outreach and also links to our member organizations that are all across California. And I thank you so much for participating and listening and being all in.
And just as a final reminder, a recording of the webinar, as well as all the slides, will be available on the website, allinforhealth.org, later today. And we appreciate your participation, and we are so happy that everyone is all in. Thank you. Have a great day.